First, welcome to beautiful New Parkland, and thank you for joining us. I see many elected officials, community leaders, current and former board members, and many former executives who've each given so very much to make this day a reality. I'm also grateful that we've been joined by very many of the donors to the Parkland Foundation. I wish I had time to mention each and every one of you by name, but I don't. So please accept my collective thank you for all of your support. I also want to thank the Parkland physicians and staff that I see here today. The building is truly magnificent, but you are the heart and soul of Parkland. This day has been a long time coming. The first study regarding a new Parkland hospital was conducted in 2004. A referendum approved its construction with 82% of the vote in 2008. And today, we stand ready to dedicate the most state-of-the-art public hospital in the nation to the people of Dallas County. We wouldn't be here without the support of the Commissioner's Court, our legislators, and all of you in our community who have repeatedly affirmed the belief that every citizen of Dallas County deserves high-quality health care. Over the course of the last 5.5 years, more than 4,000 people were put to work building this facility. Of those, 90% lived in the Dallas-Fort Worth zip codes. Our construction crews maintained a safety record that eclipsed the national standard. Thank you, Lou Saxon, and each of the 4,000 men and women who made safety a priority. Over 12,700 donors gave more than $150 million to the hospital's completion. So this hospital was not just built for the community, it was built by our community. And I've never been prouder to be a Dallas County resident than I am right now. But the purple skyline last night was pretty awesome if you saw it. It was great. Finally, I want to recognize the many contributions of Dr. Ron Anderson. It was his vision and commitment to the mission of public health that has culminated in this dedication ceremony today. Dr. Anderson is missed every day by his Parkland family, and especially today. But his legacy of caring for those most in need will live on within these remarkable walls. We have a full program today of great speakers, but before they begin, it's my great pleasure and distinct honor to present a couple of videos from dignitaries who could not be here.
The health system's first new CEO in more than 30 years. He's dedicated his career to public health, and at this time I'd like to ask Dr. Fred Cerise, the CEO of Parkland, to make a few comments.
In 1893, Dallas voters approved a $40,000 bond issue. And in 1894, Parkland Hospital began as a clapboard building on the corner of Maple and Oaklawn Avenues, where all were cared for according to their needs. The purpose of the hospital then was explained by a speaker at the dedication, who said, "After many years of waiting, the citizens of Dallas can congratulate themselves on having a place to care for the sick, second to none which exists in the state. We are glad to say Dallas now offers an asylum for her unfortunates. That is almost an incentive to induce one to become sick, could they have the benefits of this institution." I've heard that argument about this place as well. As the practice of medicine has evolved, the mission of the public hospital has remained steady. As we got better at treating illness, the public hospitals ensured that all of the public could benefit from these advances. Rich and poor bleed alike, succumb to infections, feel pain, and grieve the same. From penicillin to trauma resuscitation, from insulin to ICUs, public hospitals have not only provided access to all, they have contributed to the advancement of the science. What medical student has not learned how to care for burn patients using the Parkland burn formula? Or how to take care of pregnant women based on the documented experiences of the hundreds of thousands of births at Parkland? Either directly or indirectly, all strata of society benefit from the care and the knowledge gleaned in the public hospitals. But it goes beyond the hospital. As we learn more about prevention, the work of the public hospital evolved. These hospitals were among the first to become true health systems, sprouting phalanges in the form of outpatient clinics, not to feed the main body, but to limit it, to care for people in their communities, to prevent them from having to come to the hospital. Decades later, models of reform or incentivizing behavior today that Parkland displayed in 1958 with its first outpatient clinic and accelerated in the 1980s with its community-oriented primary care centers. When Parkland opened in 1894, medicine was a fledgling science, and while that has changed dramatically, the social challenges have remained remarkably consistent. Echoing sentiments from the 1894 dedication, Dr. Arnold Roman, the editor of the New England Journal of Medicine in 1985, warned that the nation was at a crossroads in its healthcare decisions. He praised Parkland for the commitment of the community to provide first-class health care to the citizens, regardless of their ability to pay. Roman said, we need to decide what kind of people we are. Do we care about our neighbors? Do we care enough about health care to pay for the facilities and the resources that are necessary to provide decent health care? And while the country has made progress, the crossroads that Roman described remains a wide intersection of beliefs that we have not yet been able to successfully navigate. And while that national debate that goes back to the establishment of the first hospitals and has gained momentum since the mid-1960s, while that continues, there remains the immediate need to care for all of our neighbors. And Dallas has been a leader in recognizing that need and dedicating resources and the will to do so. This new facility focuses on high-quality care and improving patient outcomes. Things such as private rooms and efficient trauma space are designed to do just that. And finally, over time, the business of medicine has changed. While commercialization has fostered gains in science and in the delivery of care, it has also fragmented care, both within and among social strata, and injected business principles into care decisions. But in many respects, public hospitals continue to represent medicine in its truest form. Sure, we have a business to run. We have to be accountable. We have to respond to market pressures, and we have to be good stewards of the public's trust. But in another sense, our direction, our strategy, our competitive niche, if you will, is remarkably clear and simple. Our mission is defined by the public need. We are driven by how to best deploy our public resources for the maximum benefit of the Dallas County residents that we serve. And while it sounds simple, that direction frees our providers to build programs and make decisions centered on the patient and not the business. That leads to dedicated and inspired providers, which is a defining characteristic of a public hospital. This state-of-the-art facility will now provide the physical environment to match the human talents to provide the best care for all of Dallas's citizens and to maintain Parkland as a national leader in healthcare delivery. I want to thank all of you for your part in making that happen. You've created something of which Dallas can be very proud. Thank you.
Next, we're going to hear from Sheriff Lupe Valdez. As the head of Dallas County's lead law enforcement agency, Sheriff Valdez partners with Parkland in our efforts to keep our community safe. Her deputies and staff put their time, effort, and even their lives on the line for the benefit of all of us. In an emergency, we want her on our side. Please welcome Sheriff Lupe Valdez.
Good morning. Y'all what law enforcement and hospitals have to do together, but really we often work hand in hand. Shift work, emergency crisis, we're all in this together. You know, but what's funny is this morning I drove out the wrong side, and as I drove up, the gentleman says, "Are you here to direct traffic?" And I just shook my head and I said, "I bet I can, but that's not why I'm here." No one wants to be sick. A healthy city and a good quality of life calls for a lot. Education, transportation, and of course, good health. There's a quote that says, "The poorest man would not part with health for money, but the richest would gladly part with all their money for health." In doing research for this occasion, it appears there is rarely an elimination of diseases. There is usually just a learned control of the disease and a method to stop the spread of it. Unfortunately, the communities that are more vulnerable to social and economic changes are the ones that are often hit the hardest. That is the poor and disenfranchised. Community become healthy through a process that brings together the best of all the participants have to offer. That is, engaged in full diversity of the members of the community and engage the community in a process of vision and goal setting. Parkland has obviously been headed in that direction. Health cannot be defined simply by the absence of disease. Mental, spiritual, and environmental well-being all play in the part of the overall health of the community. Although there is no single magic pill that provides the solution to illness, and oh, how we're all waiting for it, well, at least not yet, we look for other ways. When it comes to people's personal health concern, it often also brings fear. And to summarize, all people want to be able to trust their health provider. When there is illness and pain, people want to feel that their loved ones will be well attended and taken care of. Nothing is perfect, but with the opening of this institution, the vision continues of providing that health care and put a dent in the bringing health to the community. Thank you very much.
It gives me great pleasure now to introduce my friend, Congresswoman Bernice Johnson. Aside from being Parkland's member of Congress, you're sitting in her district now. Congresswoman Johnson is a trained nurse. Before her service in Congress, Congresswoman Johnson served as the chief psychiatric nurse at the Dallas VA hospital. Her clinical experience gives her first-hand knowledge of what it takes to serve patients with compassion and improve their lives. She's been a steadfast supporter of Parkland, and we are so grateful for her leadership. Please join me in welcoming Congresswoman Bernice Johnson.
Good morning. I am so delighted to be here this morning. And I'm so delighted to see every one of you. As I look through this audience, I don't see a single face that has not been involved with Parkland. And I'm grateful. I'm grateful for whatever role that you've played. You know, in August of this year will be 60 years of being a registered nurse. I'm quite old enough to vote, but 5 years later, Parkland became a part of my life. When my only child was born here as the only place in this city that he could be born. He is now grandfather. And so I'm grateful for Parkland and kept me in touch with Parkland. I am so overwhelmed with the generosity of this community and the caring and all the board members and all of the things that philanthropy has done for this city and this hospital and for the care. Dr. Anderson was my partner all the way through the state legislature and much of the Congress. And you know, We had many conversations about the load of work and the diversity of the patients. And the one thing he always left with me is that his number one care in his heart was about caring for the patients. He was not INS. He was a doctor, and he was the manager of Parkland. Parkland has meant so very much to this facility, to this city, and to this county. You know, for Parkland to care for almost 1 million patients a year and have almost $1 billion on compensated care, where else? For the quality of care. And year after year after year, I would see these Newsweek magazines name Parkland one of the 10 best public hospitals in the country. I was always proud. And I've always had a partner in Congress for Parkland, my colleague, Congressman Burgess, who is a product of the medical school and doing his internship and residency right here. And I'm proud of that. Because, you know, I serve with some wonderful people. We don't always agree on a lot. But when it comes to Parkland Hospital, there's no question in my mind where I can go to get a partner. And that's Congressman Burgess. And so I'm very, very grateful. And Parkland is more than just this setting where we are. Parkland is all over this community with all kinds of programs and supporting community groups and civic groups to make sure that quality care is delivered. And you know, the community health centers have been so good at making sure that patients get primary care, preventive information, so that they can learn to take care of themselves. This is an unusual institution. I've come out some weekends just to stop in to look at the emergency room. If you have not done that, it's an education unto itself. To see the willingness of these people and all of the healthcare providers looking out for all kinds of incidences and illnesses. I remember an incident very early in my young life. We were getting ready for church one Sunday morning, and my son was in a walker, and he rolled out the back door and rolled off the porch, and he split his lip. And of course, being that only child, my husband and I grabbed him up and we rushed out to the Parkland emergency room. And about 5 hours later, we woke him up and said, let's go home. Because the lip had gone down, the bleeding had stopped, and we realized how just important an emergency room is for an emergency. And so let me just say that there's absolutely no other healthcare facility in this nation that I care about most. And I'm so pleased that we are right here with a medical center as well, with 5 Nobel laureates that's connected and help and oversee some of the care at Parkland Hospital. We have a wonderful healthcare community. We have a wonderful community of people who care and who give, and I thank you.
I'm proud to say that our next speaker is one of our very own, a Parkland-trained physician. Before he was a congressman, Dr. Michael Burgess trained obstetrics and gynecology here at Parkland with our current board member, Dr. Linda Parnell. Between the two, I'll bet you there's some really good stories. During his time in Congress, Dr. Burgess has distinguished himself as a demonstrated leader on a variety of healthcare issues. Dr. Burgess, too, has always been a very, very good friend of Parkland, and we're grateful to have his support. Please join me in welcoming Congressman Dr. Michael Burgess.
Okay, can you tell a Parkland trained? I come up here with a yellow legal pad, a bunch of fancy notes. Dr. Parnell, I would just remind you, the statute of limitations has expired on most of the stuff. From the labor House officers together. And Debbie, I want to thank you for mentioning Dr. Anderson. I mean, Dr. Anderson was my resident when I was an intern at Parkland in the emergency room. So
it's hard for me to think of Parkland Hospital and not think of Dr. Anderson, and surely he is missed. Dr. Cerise, congratulations. What a wonderful accomplishment. What a wonderful vision you've had for the city, and what a wonderful return on investment for the taxpayers and the donors who have made this facility possible. Thank you to the commissioners who worked and labored long hours and made certain that the budget's all lined up and that you were actually able to finally deliver on the promise. And really, thank you to what I would say is the best of Parkland, the nursing staff, the support staff, the ancillary staff, the cafeteria staff. I learned how to eat breakfast standing up in an elevator, going from the cafeteria to labor delivery. That's one of the things you learned as a house officer at Parkland. Am I right, Winfred? But the support staff was really second to none. Of course, the nursing staff is excellent. The nursing students who were here when I was here, I know have gone on to great things. For the house staff, and I guess actually your house staff is working today. I don't see many of them here. If they were, I would say Happy Doctor's Day, because this is Doctor's Day. March the 30th of every year since 1990, signed into law. A law passed by Congress in a bipartisan fashion, signed by H.W. Bush. So Happy Doctor's Day to our house staff. You know, we sometimes focus so much on the present, we forget about the future. Yesterday or last week, we passed a bill in Congress that actually fixed a 17-year-old problem. And it's one of the things that I had been focused on year in and year out. In fact, it was some of that Parkland stamina that helped me get through that process. But for the doctors of tomorrow, they don't really so much care about what we passed last week. They're interested in what's going to happen in the future. Front page of the Dallas Morning News this morning is an article about a drug that costs a lot of money. Yeah, it costs a lot of money. But when you and I were at Parkland, that disease didn't even have a name. We called it non-A, non-B hepatitis. And some wizard came up with hepatitis C. Who would have thought it was possible? That's not curable. It's not just manageable, it's curable. That is a fantastic occurrence that has happened during our professional lifetimes. So when I talk to groups of young doctors, sure, it's easy to despair. Student debt is too high. Policies passed by the federal government are too restrictive. But you know what? This generation of doctors coming up is going to have more tools at their disposal to alleviate human suffering than any other generation of doctors has ever known. The good news is, Parkland Hospital, they're going to have a wonderful place to do it. Thank you very much for letting me do that.
It's fitting that our next speaker will be dedicating new Parkland Hospital to the people of Dallas County. In addition to serving as county judge, Clay Jenkins has been a tireless advocate for improving access to health care. And as many of you remember, he joined with Mayor Mike Rawlings to take a hands-on approach to the recent Ebola outbreak and in leading Dallas through the crisis. For our final speaker of the morning, please welcome Dallas County Judge Clay Jenkins.
Before I get to the prepared remarks, let me say this. I am very thankful to God today. God He's the God of the valley that we've walked through for the last 5 years, and He's the God of the mountaintop that we all stand on together today. So first and foremost, I want to give thanks to God. Of all the challenges that we have faced during my time as Dallas County Judge, none has been more difficult, more time-consuming, and more important to our community than saving Parkland Hospital and ensuring quality care in this new building for generations to come. Now, arguably, my best decision as Dallas County Judge was to appoint Debbie Branson to the board of Parkland. She was twice unanimously elected by her board peers as chair of the Board of Managers, and Chairwoman Branson was named the 2014 National Hospital Trustee of the Year by Modern Healthcare magazine. I want to thank each commissioner I've had the honor of serving with for their devotion to Parkland's mission. Retired Commissioner Maureen Dickey, current commissioners Dr. Teresa Daniel, Mike Cantrell, Commissioner John Welly Price, and Commissioner Dr. Elba Garcia. Personally and on behalf of the Commissioners Court, I want to thank former Chairwoman Dr. Lauren McDonald, former board members Dr. Roberto de la Cruz, Ms. Cody Russell, and Mr. Eddie Reeves, and the current board members Pat Gorman, Dr. Sherry Johnson, Sherry Bryant, Dr. Winfred Parnell, Dr. Paula Dobbs-Wiggins, Dr. Stephanie Woods, and Chairwoman Debbie Branson. A heartfelt thanks also to the late Dr. Ron Anderson, who dedicated his life to Parkland. Dr. Tom Royer, my friend Bob Smith, who's back with us today, Ted Shaw, their highly effective interim team. Thanks also to our state and federal partners, former Texas Health Commissioner Dr. David Lakey, who was an indispensable partner not only to Parkland, but on the West Nile virus and the Ebola outbreak as well. And David Wright with the Center for with the Center for Medicaid and Medicare and Medicaid Services and his team. All of these leaders lay the groundwork for our amazing current CEO, Dr. Fred Cerise, and his outstanding team. To the doctors, nurses, employees, donors, and volunteers of Parkland and the Parkland Foundation, please know you have our sincere gratitude for your countless acts of love and service. The Commissioners Court, the Board of Managers, the C-Suite, the doctors, the nurses, the employees, the donors, and the volunteers close ranks and work together to make this day possible. New Parkland will ensure that everyone in Dallas County has access to quality health care, cutting-edge technology, and a healing environment. New Parkland makes health care in Dallas County more equitable to 133,000 Dallas County working poor citizens, denied coverage by our state's refusal to expand Medicaid coverage, and hundreds of thousands more, mostly low-income residents who lack access except through Parkland and charity care. New Parkland is a county hospital that will serve our 2.5 million person Dallas County community. New Parkland will be providing the same life-saving care and still be directed by the same mission, but in a building that was built for the community, by the community. New Parkland improves the health status of Dallas residents and allows us to truly treat our neighbors as we want ourselves and our families to be treated. It's a shared basic tenet of faith to love your neighbor as yourself. But once we try, we quickly learn that this is difficult to do. We learn that the world is seen through the eyes of one person is barely recognizable through the eyes of another. We learn that our perspectives and our desires are not universally shared. Compassion is hard to deliver. The women and men of Parkland are on a mission to deliver top quality, compassionate care and treat their neighbors as they would want to be treated. Every person in this room has played an indispensable leadership role in this milestone on that road to our shared mission. On behalf of the 2.5 million citizens of Dallas County, thank you all for your unique and vital contributions. And on behalf of the Dallas County Commissioners Court, Dr. Teresa Damon, Commissioner Mike Cantrell, Commissioner John Welly Price, Commissioner Dr. Elba Garcia, it is my honor to dedicate this hospital to the people of Dallas County. May God bless the people of Dallas County and all of you with generations of top quality, compassionate care. Thank you.
Here, and I want to acknowledge on behalf of the board and the hospital the wonderful relationship, the partnership that we have with the doctors at the medical schools. We appreciate you. Thanks for being here. Having said that, that concludes the program. We've got lots of good refreshments and there are tours available if you'd like to see this fabulous new facility. So enjoy.